topic is chest pain. The questions which can be framed on chest pain are: write a short essay on the differential diagnosis of chest pain, list the non-cardiac causes of chest pain, elicit appropriate history for a cardiac disease, analyze the symptoms such as breathlessness, chest pain, palpitation, syncope. Now, what is chest pain? Chest pain is a common symptom of cardiac disease. It can be due to non-cardiac causes as well, such as anxiety or disease involving the respiratory, musculoskeletal, or gastrointestinal system. Now, what are the common causes of chest pain? First is cardiac causes involve cardiac artery disease or angina pectoris. Chest discomfort from reduced blood flow to the heart, often triggered by exertion and relieved by rest. Myocardial infarction. Heart muscles death from a blocked coronary artery cause severe prolonged pain, sweating and breathlessness, which is a medical emergency. Vascular disease such as damaged heart valves can cause chest tightness, breathlessness, or fainting depending on which valve and severity. Mitral valve prolapse. Leaflet flopping of the mitral valve that may cause palpitations, atypical chest pain, or none at all. Aortic stenosis or regurgitation. Narrowing or leakage of aortic valve leading to exertional chest pain, syncope, or heart failure symptoms. Pericarditis. Inflammation of the pericardial sac causes sharp pleuritic chest pain that often improves by sitting forward. Hypertrophic cardiomyopathy. Thickened heart muscle causing exertional chest pain, dizziness, or sudden collapse, important in young patients. Now, vascular causes. Dissection of aorta, which is a tear in the aortic valve causing sudden severe tearing chest or back pain and unequal pulses, which is life threatening. Now, pulmonary causes. First is pleurisy or pleuritis. Inflamed pleura causes sharp, worse on breathing chest pain, often with cough. Pneumothorax. Air in the pleural space causing sudden unilateral pleuritic pain and breathlessness can collapse the lung. Pulmonary embolism. Clot blocking pulmonary arteries causing sudden pleuritic chest pain, shortness of breath, and possible collapse. Pneumonia. Infection in the lung can produce localized pleuritic pain with fever, cough, and sputum. Now, gastrointestinal causes: reflux, esophagitis, or GERD. Acid reflux causing burning retrosternal pain, often after meals or when lying down. Diffuse esophageal spasm, uncoordinated esophageal contractions causing abrupt squeezing chest pain that can mimic angina. Hiatus hernia, stomach sliding into the chest can worsen reflux and cause chest discomfort. Peptic ulcer disease, epigastric or retrosternal burning pain related to meals may mimic cardiac pain. Cholecystitis, inflamed gallbladder causes right upper quadrant pain that can refer to the chest or shoulder. Pancreatitis, inflammation of the pancreas causes severe epigastric pain that may radiate to the chest or back. Musculoskeletal causes involve costochondritis, which is inflammation of the costal cartilage causing localized reproducible chest wall aggravated by movement. Arthritis, degenerative or inflammatory joint disease near the chest wall causing persistent pain with movement. Muscle spasm, strained or tight chest wall muscles cause sharp or aching pain worse with movement. Bone tumor, rare cause but persistent localized pain, sometimes worse at night and not relieved by rest. Neural causes involve shingles or herpes zoster, reactivation of varicella virus along a thoracic dermatome causing burning unilateral pain, often followed by a vascular rash. Emotional causes involve anxiety, panic, or chronic anxiety can produce chest tightness, palpitations, hyperventilation, and fear mimicking cardiac pain. Depression, low mood, and somatic symptoms can include vague chest discomfort or heaviness without a clear physical cause. Now, differential diagnosis of chest pain. Potentially life threatening causes involve acute MI. It involves STEMI or non STEMI. Coronary artery occlusion causing prolonged severe central chest pain, diaphoresis, nausea, and breathlessness. Immediate reperfusion may be required. Unstable angina, new or worsening ischemic chest pain at rest or minimal exertion. High risk of progression to MI. Urgent evaluation and treatment is needed. Pulmonary embolism. Sudden pleuritic chest pain and dyspnea from embolic occlusion of the pulmonary arteries which may cause hypotension or arrest. Aortic dissection. Tearing, tearing chest or back pain with pulse, blood pressure differences. Rapid diagnosis and emergency surgical or endovascular care are critical. Myocarditis, which is inflammation of the myocardium causing chest pain, heart failure, signs, or arrhythmias, can mimic MI but often follows a viral prodrome. Tension pneumothorax, sudden unilateral chest pain, severe breathlessness, and hemodynamic compromise from trapped intrapleural air. It is an emergency decompression is life-saving. Next is acute chest syndrome or sickle cell. Vaso-occlusive pulmonary process causing fever, chest pain, hypoxia, and new pulmonary infiltrate, which is an urgent supportive and disease specific. Next is pericarditis, when causing tamponade. Inflammatory chest pain, often pleuritic and relieved by sitting forward. If complicated by tamponade, it becomes life-threatening. Boerhaave syndrome or esophageal perforation. Severe pleuritic chest pain after vomiting with mediastinitis. It is a surgical emergency. Perforated peptic ulcer with free air or sepsis. Sudden severe epigastric or retrosternal pain or peritonitis and systemic instability which needs urgent surgery. Acute pancreatitis, which is severe epigastric pain can radiate to chest or back, systemic inflammatory response, and potential multi-organ failure. Acute cholecystitis, which is complicated, right upper quadrant pain that may refer to chest complications such as sepsis or perforation, which can be dangerous. Common non-life-threatening causes include biliary colic, episodic right upper quadrant or epigastric pain from the gallstone obstruction, often postprandial and self-limiting. Gastroesophageal reflux disease. Gastroesophageal reflux disease, which is the burning retrosternal pain which worsens after meal or lying down, often with regurgitation. Next is peptic ulcer disease, epigastric pain or gnawing pain that may mimic cardiac pain. Relation to meals varies by ulcer location. Next is pneumonia, infective chest pain with cough, fever, localized crackles, and consolidation on chest X-ray, which is treatable with antibiotics. Pleuritis. Sharp pleuritic chest pain worsens with inspiration and coughing, often accompanies infection or inflammation. Pulmonary hypertension, chronic exertional chest discomfort and syncope from elevated pulmonary pressures and right heart strain. Next is costochondritis or Tietz syndrome. Localized reproducible chest wall pain at costochondral joints, benign and usually self-limited. Intercostal myalgia. or neuralgia, muscle strain or nerve irritation causing focal movement related chest pain. Rib fracture, trauma or severe cuff, focal chest wall pain worsens by movement and deep inspiration. Bone metastasis in ribs, such as persistent focal pain, often worsens at night and it is considered in cancer history. Born-home disease or pleurodynia, Coxsackie viral illness causing sharp stabbing chest or abdominal pain with fever. Thoracic radiculopathy or Taxider's twinge or precordial catch. Brief sharp precordial pain episodes, benign and self-resolving, often in young people. Next is anxiety or panic attacks. Intense chest tightness, palpitations, hyperventilation, often with fear and autonomic symptoms. Common but rule out cardiac causes first. Next is shingles or herpes zoster, burning unilateral dermatomal pain that later develops. A vesicular rash pain may precede rash by days.